we are again, still at it. Really feeling good. Had a couple of aches and pains after last week's workout, but it felt good and felt stronger after the fact. Played ball again as usual on Sunday. Had good mobility, no pain, so we're here to improve on a good situation. So warming up again. At a higher level of difficulty, we put on a little bit more time, so we're working it.
When most people are familiar with the hamstring stretch, which is this, which is great. Hamstrings are important. They pull us front to back. So hamstrings are a major extender of our hip, and it flexes our knee. So it pulls us, it basically pushes us forward. But it's also very important to get the rotation muscles. So while the hamstrings and the quads here, hamstrings here, they move us front to back, a lot of our movements in life in general are rotation muscles. So those muscles across the buttocks and across the hips, namely the piriformis, namely the glute medius, those muscles have to be stretched as well to keep the whole hip flexible. So I'm going to go across here. And these are stretches that you can do at home. These are stretches you can do at home. Some of you can ask me how. So basically there's two stretches that everybody's familiar with the hamstrings. But we're going to go over specifically the glute medius and the piriformis stretch. So the piriformis stretch is a major rotator of the hip. And how to stretch the piriformis is to bring the knee and leg try to get it across the body almost to 90 degrees and then go outward with it. And we're going to take it easy. We're going to take it easy. 3, 2, 1. What I like to do, I like to stretch it out between stretches, just so that the hip can reset, the muscles can reset, the nerves can reset, and the fascia can reset. So again, this is the piriformis stretch, going across the body. 3, 2, 1.
See any difference in?
It's hard to say.
It's
hard to say because where we were at first week, I think we're doing a lot better with our hip flexors. Between now and now we're in week 3 compared to our first week. I know our hamstrings are a lot better. Hamstring muscles are a lot better. Now our rotational muscles, like our piriformis, compared to week 1, I would say that's better too. But especially going across into our glute medius stretch, what I noticed is we can definitely isolate the lower back, because before, when we started, everything was kind of moving together like this. Now we can isolate it a little bit better.
Okay.
Across.
Okay, yeah.
3. Think about the hip. The hip is actually a ball and socket joint, so it's the second most mobile joint in our body compared to the first one being the shoulder. Right. So it's a ball and socket joint. So a little bit of range of motion, increase in range of motion, means a lot in function. So this is the test right here. Now,
that's better than the first
a
one.
Lot better.
Yeah.
Now what we've noticed is, but you've been doing a lot of work working on your glutes. And I see you doing the lunges, and we're doing the hip flexors, which is helping out opening up the hip so that we can get across this way.
Okay.
3, 2, 1. So what we can see is with stretching, with exercising, and treating the hip, we got increased range of motion. And let's think about what brings a person in when they have hip degeneration and they're trying to avoid a total hip replacement. It's the pain, it's the lack of function, it's the lack of range of motion, it's the inability to walk comfortably. And at this point, we're improving our range of motion, we're obviously improving our strength. Jabulani is a great example of somebody that puts in a lot of work. And we're seeing our flexibility, which means it equates to increased function. 3, 2, 1, and relax.
It's like being in a gym with a personal trainer. It's great. Come on over to Goldson, your local health gym.
I would say that right now we're ahead of schedule from what I expected. A lot of that is because Jabulani puts in a lot of good work and he's diligent about it. What we do here at the office, I would say is about 60%. What you do at home on your own as far as stretching and keeping up with your stretches is an additional 40%. Being consistent. What keeps our hip together, it's a mobile joint, but what really keeps it together are the ligaments. So we have to keep the ligaments stretched and flexible. So doing it at the office sometimes, a few times a week is great, but also keeping up with it at home.
It's a must.
It's a must. 2, 1. That's great. That's great. 3, 2, 1. So let me ask you a question. Are you still having the same pinching in the hip?
No,
Okay.
no, not like that.
Okay.
It's a little tight sometimes and I feel a little sensitive, but the pain, nope.
Excellent.
Going coach, you prove a point. Doing exercise is not just a physical thing, it's also mental.
Exactly.
So you gotta concentrate and know what you're doing. Boom. I just did it wrong a while ago, I messed up because I wasn't mentally out there, so back to the groove.
And what are hip flexors? Hip flexors are the muscles around the hip area on the front of the hips that causes the knee to go like this. It actually flexes the hip. Those muscles can get really tight. And because they actually attach to the spine, your hip flexor muscles actually attach to the spine and down into the bones of the hip to actually, when they contract, it flexes the hip. It can actually affect the back as well as affecting the hip. So I'm going to show you an effective hip stretch, and we'll actually show how you can do this at home. Great if you have a loved one at home to help you with your stretches, but you actually won't stretch yourself as hard as someone else will.
3. Just like how you service your car, you gotta service your body. So come and see the doc.
Good stuff. Take home note today. Stretching of the hip is key. Stretching your hamstrings, definitely do that, but definitely stretch the rotators of your hip, your piriformis and your glute medius, and make sure that you notice what's going on with your hip flexors. If you're tight around the front of your hip, it's hip flexors. And if you're starting to notice that you're having low back pain, that might be a sign that your body's compensating as a result of tight muscles. Don't allow your hip to become more degenerated than it already is. If you're starting to already have pain in the hip, if you're starting to notice some sharp pain when you're walking or trying to go upstairs, now's the time to come in, because the longer you wait, the more degeneration can happen because the ligaments are getting tighter. Come in and see us, or start stretching on your own. Some of the stretches that you've seen here, us do with the Jabulani, are great to do at home. They're safe and they're very effective, and definitely some of the exercises. Some of the exercises may be a little bit challenging for you at this point, so you may have to start at a lower level. But the whole point is, don't allow it just to persist and continue without getting treatment.